Senate Republicans introduced their health care bill, but the much-anticipated plan may be dead on arrival as Republicans already aren't happy. The Senate's plan to overhaul the Affordable Care Act eliminates Obamacare's mandate for Americans to have insurance, allows states to apply for waivers to opt out of covering essential health benefits like maternity and drug abuse care, but protects coverage of pre-existing conditions. It eventually calls for deeper cuts to Medicaid, defunds Planned Parenthood, and restricts abortion coverage. President Trump is already looking ahead to negotiations.
We'd love to have some Democrat support, but they're obstructionists. They'll never support. We won't get one, no matter how good it is.
Democrats jumping on the president's comment that the House version of the bill was mean. The Senate plan they call even meaner.
This is a nasty bill, and they're trying to cover it up with little things here and there.
If the bill passes, it goes back to the House.
So sad, Mr. President. Heartless. Mean and heartless. And this is the same thing. It's the same thing all over again.
I want them to pass the bill so we can all get on with keeping our promise.
At this point, it appears Republicans do not have the votes to pass it. They could only lose 2 votes, but 4 GOP senators have already come out against the plan. The Medicaid cuts could really hit New Mexicans hard. There are 900,000 people on Medicaid in our state. That's about double the number of people in Albuquerque. And about 250,000 people could lose coverage under the plan. Action 7 News reporter Sandra Ramirez spoke with one man who says if it passes, it would be catastrophic for him.
These are Adam Shan's wheels. The price tag on this wheelchair is a little more than the average cost of a car. Shand has cerebral palsy. Medicaid paid for this chair. Without it, Shand would be stuck in bed all day, which is what he's worried could happen to hundreds of thousands of New Mexicans if their Medicaid benefits are cut.
It would be catastrophic.
If he were to add up the cost of health insurance, medication, medical equipment, Shand estimates it would be
$1 million per year. Or 2.
Those costs are similar for a lot of other New Mexico families who have children with special needs. Shand works for Parents Reaching Out, a nonprofit that helps connect a lot of those families with resources, including Medicaid. He tells me 40% of New Mexicans receive Medicaid benefits, more than any other state. And like many of those hundreds of thousands of families, Shand is uncertain of the future.
I have the proposal. But do I know for a fact it's going to be covered? I can't adequately answer that right now.
In Albuquerque, I'm Sandra Ramirez, KOAT Action 7 News.
We got a chance to ask Governor Martinez about what she thinks about the proposal. She hadn't gone over it, but here's what she wants in the plan.
Obamacare really has been a disaster and a failure because actually millions of people in the country have lost their insurance, and it has become much more expensive for families and small businesses to have insurance. And so we have to make sure, number one, that we're protecting the most vulnerable in our state, but that also we're not raising costs on our families.
And our lawmakers are responding. Senator Tom Udall spoke on the Senate floor against it, and Senator Martin Heinrich talked to our Washington newsroom.
And when President Trump said that the House version was a mean bill, this is a meaner bill. They are not necessary. These cuts are meaner, and they are not necessary to repeal the Affordable Care Act. They will hurt millions of Americans.
It makes deeper cuts to Medicaid, for example. That's going to decimate our ability in New Mexico to treat people for opioid and heroin addiction.
Congressman Ben Red Lujan called the bill mean as well and heartless. We reached out to New Mexico's only Republican representative, Steve Pierce, for comment, but we did not hear back. Well, this